Hi, this video is brought to you by the UAA Dental Hygiene students in Anchorage, Alaska. And we are going to talk to you about how to take care of your teeth during pregnancy and take care of your kids' teeth during the first few years of their lives. You should have been provided with this pamphlet called Your Child's Teeth. This pamphlet was created by the American Dental Association, and it is generously provided to you by Welter Dental Center located in Wasilla, Alaska. You can use this pamphlet as a reference guide as we go through this video. It's got a lot of great information and will be a great resource for you during your pregnancy and during your kids' first couple years of their lives. All right, my name is Shayna, and we're going to start off by talking about pregnancy. Dental care during your pregnancy is safe at any point throughout the pregnancy. You can get cleanings and dental treatment done. But if this is something that you're concerned about, the second trimester is considered the most safe. Also, x-rays are safe during your pregnancy as needed, and that is approved by the American Dental Association and the American Pregnancy Association. However, if it is something that is concerning for you, you can ask if you can wait until after your pregnancy. Just be sure to let your provider know if you are expecting. Hormones can play a big role during your pregnancy in increasing your chances of getting a gum infection called gingivitis. You might notice some swelling or some bleeding when you spit in the sink when you're brushing your teeth. So just know that that could be more common if you are expecting. Eating a healthy diet while you're expecting is very important, as you probably already know, but not only for your baby, but also for your oral health. Some nutrients that you want to make sure and stay on top of to support your dental health during your pregnancy are going to be calcium, phosphorus, protein, and vitamins A, C, and D. Calcium is a really important one. You want to make sure to consume enough to support your dental health and also provide calcium to your baby. Your baby's teeth actually start to develop before birth. Something that is important to note is there is a myth out there that says that if you don't take enough calcium, that your baby will start to take calcium from your teeth. That's not actually true. Your baby only gets calcium from your diet and what you consume. Tooth decay can be prevented with good oral care. Refer to page 4 to 6 for some great tips on how to care for your child's teeth with good brushing techniques and how much toothpaste to use depending on your child's age.
As seen on page 12 of the pamphlet, before your baby's teeth begin erupting, it is beneficial to be in the habit of wiping your baby's gums after breastfeeding and meals with a damp cloth. Brushing should begin after the first baby tooth erupts. You will need to brush your child's teeth until they are able to do so adequately. It is safe to say if your child cannot tie their own shoes, they cannot brush their own teeth. Brushing should be done in the morning and at night with a soft child-sized toothbrush. Use only a rice-sized amount of fluoridated toothpaste. Position your child so you can easily see into their mouth. This can include having your child lay their head on your lap or sitting with them in your lap in front of a mirror.
Everybody, my name is Tatiana, and today I'm going to demonstrate proper brushing and flossing techniques for your child.
When brushing your child's teeth, it is important not to use a scrubbing motion. Proper brushing includes brushing 5 to 8 circles on each tooth with the bristles angled towards the gum line. Electric toothbrushes are great, but manual toothbrushes can be just as efficient with the use of proper technique. Once your baby has 2 teeth come in next to each other, begin flossing between them. Some tips and pictures of proper flossing can be seen on page 6 of the pamphlet. Guide the floss between the teeth using a gentle rubbing motion. When the floss reaches the gum line, curve the floss around one of the teeth and gently rub the side of the tooth using an up and down motion. Repeat this step for the opposite tooth. As you continue to floss between your child's teeth, unwind clean floss off of one finger and wrap the used floss onto the other. When your child begins to brush and floss on their own, it is important to watch them to ensure proper technique as well as being able to assist when necessary.
Let's talk diet. What your child eats plays a huge role in their susceptibility to cavities. When your child consumes sweets and carbs, the bacteria in their mouth metabolizes it and produces an acid, which can erode their teeth over time. Be aware that constant snacking can also increase the risk for cavities. The pH in the oral cavity becomes more acidic every time we eat, so if the child is frequently snacking, it can keep their oral cavity in a more acidic state for a longer period of time. Page 7 offers some suggestions on healthy foods and what foods to avoid. Fun fact, xylitol is a great alternative to sugar. The bacteria are attracted to it, however, they cannot metabolize it and eventually die off. So xylitol can actually kill harmful bacteria in the mouth.
Hi, my name is Ronnie, and we will be talking about baby teeth. As baby teeth come in, babies may feel sore or tender on their gums. Here are some tips that we can do to minimize those discomfort. Here are the do's and don'ts for teething. So the do's, give your baby a clean teething ring and also gently rub their gums with a clean, moist towel. The don'ts would be, do not use any Orajel or benzocaine products as per the FDA because it can cause serious risk to our kiddos. Here are some tooth decay prevention habits. Do not put a pacifier in your mouth before giving it to the child. Decay causing bacteria can be passed on to them. And also, limit sugary liquids like juice, and do not let your child sip on sugary liquids all day. Do not put your child to bed with a bottle or a training cup. Milk can pool around the baby's teeth, and this can cause tooth decay.
We're going to talk about children ages 6 to 12, and you can reference the pamphlet for pages 14 through 16 to look at some information on this age group. Children will begin losing their front teeth around ages 5 or 6. The first permanent or adult tooth will erupt at age 6 to 7. Sometimes children lose their baby tooth before the adult tooth comes in, and then it's important to see your dentist on a regular basis so that the space can get reserved for the adult tooth by placing a space maintainer. Once the permanent tooth starts to erupt, the dentist will remove the retainer. Protecting the newly erupted adult teeth is really important. So at the time when the permanent teeth are in, the dentist will recommend placing sealants to protect the teeth from decay. You can refer to page 16 for pictures of what a sealed tooth looks like. Sealant is a plastic material that's put on the chewing surfaces of the back teeth. Sealant material flows and seals all the grooves and crevices, which can be pretty deep and cannot be efficiently cleaned by toothbrushing, because the toothbrush bristle is too big to reach inside the groove. Sealants are fast, inexpensive, and prove to protect teeth by sealing the grooves, thus preventing chances of developing decay. When adult teeth are starting to come, some children can develop a bad bite. All right, let's talk about occlusion, and this is going to be when your child bites down and how they might bite. If it might be crooked or have an underbite or an overbite. When adult teeth start to come in, some children can develop a different looking bite. Crooked and crowded teeth may pose some risks, such as causing trouble eating or speaking. It is hard to keep the teeth clean, thus increasing chances of getting cavities and gum disease. Crooked teeth may also make a child feel less confident about their smiles and overall looks. If your regular dentist notices that treatment is needed for the child's crooked teeth, he or she will refer you to an orthodontist who specializes in correcting bite problems. All right, let's talk about handling dental emergencies. If you look at the very last page in your little booklet, you'll see that there's a nice reference page there for you. First, let's talk about if you get a tooth knocked out or your child gets a tooth knocked out. Go to the dentist immediately. While it is normal for children to lose baby teeth, accidents can happen and can cause harm to the permanent tooth behind it. If the tooth is completely out, do not put the tooth back into the socket. Bring the tooth and all of the pieces to the dentist. For adult teeth, the tooth should be put back into the socket if possible. If the tooth cannot go back into the socket, hold it by the top and not the root. If it is dirty, rinse it but do not scrub or remove any of the attached tissue. Gently hold the tooth with a washcloth. Let's talk about preventing dental injuries. Sport-related traumas can be prevented by wearing a mouth guard. Mouth guards are made to protect teeth by cushioning the damage to your mouth from a heavy hit. Your dentist can make a custom mouth guard for your child, but there are some ready-made mouth guards available in the regular stores. Prevention is the key to a healthy smile. For a broken or cracked tooth, go to the dentist immediately as well, and bring all the pieces if possible. To keep the area clean, rinse the mouth with warm water. Wrap the broken pieces in wet gauze or a towel. Place a cold compress on the face to reduce swelling. In the case of a bitten cheek or tongue or lip, clean the area with a cloth and place a cold compress to reduce swelling. If there is a lot of bleeding that continues for 1 to 2 hours, go to a dentist or urgent care. If an object becomes caught between teeth, do not try to remove the object with a sharp instrument. Gently try to remove the object with dental floss. If this doesn't work, take your child to the dentist. For toothaches or a swollen face, it is important to take your child to the dentist or physician as there may be a serious infection present. The mouth should be rinsed with warm water to clean it out. You may give your child what you normally give them for pain, but do not place aspirin directly on the affected area. In the case of a broken jaw, apply a cold compress to control swelling and take your child to an urgent care center immediately. Thank you so much for watching, and I encourage you to hang on to this booklet as a great resource for dental care. And if you aren't already seeing a dentist, I encourage you to make the phone call and get scheduled this week and get your kids in as well. Thanks so much.